we are on day 5 of the nurses strike across the country. No, not across the country, but across different counties. And there was a court order requiring nurses to resume duty and allow time for the conciliatory efforts to carry on, negotiations to go on. But we now have information that the Salaries and Remuneration Commission has advised the Council of Governors not to raise any benefits for the nurses, saying that that would mean that they are treated better than the rest of the public service. And I'm wondering, the nurses signed returned, what do you call it, CBA, in November 2017.
Right.
They gave notices November 2018. Now this advisory is coming now.
Well, the main problem is that people don't understand nurses, and I think it is not about salary alone. It's about many other aspects, even conditions and terms of service,
and staffing,
the environment where they are working, the workload that they are engaging in, the provision of certain materials, whether they are drugs or other facilities for the hospitals, the protection in terms of what protective measures, because they're engaging with patients who may have certain diseases that can be passed to them. So it is a raft of many things, and when we just narrow it down to salary, that is the narrow way of looking at it. And when there was that CBA arrangement, it was among others were these things. So what we should be looking at is, yes, we said we are going to make your conditions better. Have we achieved? And that is where we need to. But you see, this advisory is the same thing that we are saying, lack of communication in government. There is lack of communication, and people are treating some of these, what we call labor issues, like just a side job. Sorry.
It's okay.
They are not taking it seriously. Such that when there is a meeting, somebody said, okay, Sam, go for that meeting, and this is the position of the ministry. Instead of engaging almost on daily basis with these organizations to know how far have we gone. So I think Salary and Remuneration Commission should think deeper instead of just acting like policemen. You saw even the issue with TSC the other day, almost running away from the negotiations, and yet they should have been negotiating over a period. So these are some of the things that worry me. Why is the government not communicating? Yeah.
So Mombasa County had already signed the agreement, but they retracted. They had honored the CBA, but they retracted and withdrew the uniform and the nursing service allowances from the January salary rather. And apparently it's based on the advisory that is coming from the Council of Governors.
You see, I think that's where we, and I don't want to call it a problem, but we would like to hear what the Council of Governors, because I believe that's where the solution should be coming from. Why the Council of Governors are, retracting back from the CBA. I really wanted to hear that. Right now, I cannot, fervently say that I know what is going on when it comes to the back and forth between the nurses unions and the COG. But I think we need to get a very clear communication as to why that is not going on. What I know for sure after the president, the last remark was, I think it was with the doctors, when he was so crossed with them and he said he will never engage like this again, and he actually disbursed money to governors. And even at that time, some counties, some governors moved very quickly to pay the doctors, but others took long. And so I was asking myself, Sam, why are others so swift to alleviate a situation and have Wanjiko get services in hospitals, while other governors are actually holding the money and, and they are not giving a clear way as to why they are not releasing that money. So I think at this point, I would really, really wait to see what the Council of Governors will come up with.
Right. Your final word, Patrick.
Actually, I think my final word in this, one, I wish to say that I'm a health profession myself. In Parliament, I sit in the Health Committee. The health problem in this country is a deeper problem than you want to see it. Like Waziri said, it's not a salary problem. Going back to what I said about the Big Four agenda, we have a president here who who really wishes this country well and want to achieve agenda for health being one of them. But with the devolution and the structure of government we have, how will the president achieve this agenda of health when, like Mutuma is saying, we are still waiting for the Council of Governors to say? It means the president has no control over the same agenda he wants to achieve. And as we say, if you look, I had a CEC from, I don't know, Kisumu or what, saying another day, that for them to achieve quality health, they require 4,000 nurses in that county. But the current number is 700. So look at 700 nurses trying to cover the work of 4,000 nurses. I think when people talk about the Salaries and Remuneration Commission with a lot of respect, I would urge them to respect all the workers with a lot of respect. Because when you start writing letters at night of how good health workers are being paid, I wish you can go to a health center back in Tharaka-Nithi that is served by one nurse from morning to evening, and the queue cannot even end, and you're just saying how well they are paid considering other workers. I think that's a joke, and the president needs to crack a whip, because I think there's disrespect. When the government is already in negotiation, a team has been formed, the cabinet secretary is already on the table negotiating with all the workers, and now you issue a final directive that no, these salaries cannot be increased, this cannot be done. When you are counting withdrawing even uniform allowances for nurses, Mubasa mentioned, how do you withdraw uniform allowances, even uniform allowances for all the workers? I think we are joking with the life of Kenyans. Now, in Parliament, you are suggesting that we need a health commission in this country. Let the county governments handle infrastructure. Let them buy drugs. Let them build hospitals. But the issue of human resource, promoting and paying health workers, let it be handled by a commission, just like a teacher service commission. Because me as a member of parliament today, I build classrooms, but I don't employ teachers. I don't promote teachers. Because what happens with most governors, salaries is a major problem to most governors, because when you take money from your allocation and pay salaries, as a Kenyan governor, and the thinking of contracts, what do you gain from paying people salaries? So Mutuma, they are saying as we say, they withhold. They don't withhold. They don't pay doctors. They issue contract to build rooms, calling them maternities. If you go to every county, you find the structures constructed, the hospitals, but there's no nurse, no drugs, nothing. So I think the issue of health in this country needs to be handled more seriously. Okay.
This is a situation that we appear not to have gotten a solution, despite the lessons that were taught to us in 2017. After that doctor strike that crossed over since late 2016 into 2017. Still that Health Service Commission being proposed, but apparently the crises continue. Now, as Kenyans, we embrace the BRT buses that are yet to be purchased by the government because it will ease the congestion witnessed in Nairobi City. But my question goes, was the money for the buying of the buses fixed before in the national budget of the year, or is it just an abrupt plan which is going to add huge debts to the country along pulling back projects which were to be accomplished this year? That is Merika Kenya from Narok. Do you have an answer? It's a hard one.
But I would like to know. I for sure hope. Mheshimiwa is in parliament, but I sure hope they hear the budget.
The BLT has been a discussion for quite a while. So, as you said, there's a budget for it. But now this budget, who was consulted as
I thought you had to give us an answer. You're just defining the problem.
It boils down to consultation of stakeholders.